3.5 kgs of coffee each every year. That's about 550 espressos. That is a lot of caffeine, Maura.
Yeah,
Do you drink a lot of coffee?
I drank more of it. I try to curtail a little bit, but I do like my coffee, and I think especially in the morning. But of course, it's not just coffee that contains caffeine. It's also in tea, it's in cola, quite a lot in energy drinks, even sweets and even chocolate. But here to tell us about, I suppose, our growing obsession and addiction with the drug is Dr. Chris Luke. Hi, Chris.
Hi, Maura. Hi,
How are you?
How you doing?
Very good.
Chris, it is a big deal for us, and I mean, caffeine is everywhere, and it's in a lot of stuff we don't even realise.
Yeah. Caffeine is reckoned to be the most popular psychoactive substance, meaning that it affects your behaviour and your mind in the world. And it's said that 90% of the population of the world take caffeine every day. And as you've suggested, there's caffeine in a lot of things, particularly drinks, but also in sweets, increasingly, sweets like this.
They're just ordinary mints, aren't they?
Well, they're not ordinary mints. They're actually, there's as much energy and caffeine in a mint like this as there is in a large and a strong cup of coffee. Or in fact, there may be even 10 cups of coffee's worth in just one sweet. These have become very fashionable in the States, and there's actually been deaths.
But people get mixed up, I think, sometimes, Chris, between energy and caffeine.
They do.
And they kind of switch them over and back and use them for different reasons.
It's a lot of what's been going on in like the nightclub scene, the nighttime scene, has been what I would call the industrialization of old-fashioned pleasure. So, you know, in the olden days we had beer and we had wine and we had spirits, and they were all produced in a kind of organic way, traditional methods. Then we had the advent of chemistry in the 1990s, beginning with ecstasy. I've often said that during the first few years of the acid house scene in the late 80s and the 90s, Manchester, Liverpool, London and so forth, the amount of alcohol being consumed collapsed, and the drinks industry fought back, and about 3, 4, 5 years later they were producing all these kind of fancy, you know, alco pops. And what changed then was that young people began to be attracted to very trendy looking drinks. It was all about the packaging and the flavour and the colour. So the more neon, the more luminous, the more scientific it looked, the better. And of course the food industry is not far behind the drinks industry, and they have done the same in the last 5 to 10 years with energy drinks, and now more recently the candy industry in North America has been producing sweets, little sweets like that, mints and other sweets that contain as much caffeine in them as a large cup of strong coffee.
Chris, take us through what we have here on the tray. I mean, I suppose the traditional caffeine that we'd associate would be with coffee. Yeah. But I mean, also caffeine is in tea. Yeah. But you're looking at
basically, just in a nutshell, a rule of thumb. 1 coffee equals 2 teas, 1 tea equals 2 colas. That's the kind of way. So cola is about a quart. I say cola, I mean a caffeine-containing beverage. Yes. So they're about a quarter as strong as a cup of coffee. Tea is about half as strong. That's the nutshell. But of course, it depends on how much coffee you put in. And we all know perfectly well that we all use, you know, different amounts of coffee in our, you know, whether it's granules or instant or whatever. And of course, each brand has different strengths. So famously, Starbucks coffee is twice as strong, or has twice as much caffeine as McDonald's. Even both are very, very tasty.
But caffeine per se, Chris, is not bad for you. Like a cup of coffee has benefits too.
I mean, this is the old-fashioned word moderation. Look, in a nutshell, a cup of coffee has about 100 milligrams of coffee, or caffeine rather, sorry. And the medicine suggests that about 3 cups of coffee, 300 milligrams or less, is actually good for you. And studies suggest that it's an antidepressant. So there are studies suggesting that women who drink 3 cups of coffee are less prone to depression. It seems to be the case that, in fact, 3 cups of coffee protect you against strokes, against Parkinson's, even type 2 diabetes. So coffee is actually potentially very, very good for you.
So coffee as opposed to caffeine?
Coffee containing caffeine.
Yeah, with caffeine, but the amount of caffeine is about 3. In other words, 3 cups of strong coffee a day, keep it to that. Above that, you start running into problems that are directly caused by caffeine. So you get what's called caffeineism, which is basically the jitters, you know, palpitation, the shakes, insomnia, unable to sleep, and that sort of stuff.
People are more prone to that than others, though, Chris. I mean, I know somebody who will have 1 strong coffee, and if they have a second coffee, they will have the jitters. Personally, I don't get that.
Yeah, that's an incredibly important point. Everybody's very different. And one man's meat is another man's poison. That applies particularly to drugs and particularly to caffeine. So, here's another thing. If you're a white European woman who smokes, you will metabolize or break down caffeine much faster than a Japanese male who doesn't smoke. So it's as variable as that. There's ethnic changes, the drugs you're taking, the smoking, all that kind of stuff. So, you know, there are individual variations both in the way we deal with it and, of course, in the amount of caffeine there is in it. There are other problems with caffeine and coffee. There can be, in a drink like this, these are very popular drinks, particularly the iced versions in many
like
of the well-known brands.
or one of those,
Exactly, the mochaccino and all that kind of stuff.
They are nice though.
Oh, they're delicious.
Yeah.
But of course, the reason why they're delicious is because the drink and food industry is putting things into it that human beings love. So there's lashings of sugar. There may be 11 teaspoonfuls of sugar in one of these. There may be 400 milligrams of caffeine, which is the equivalent of 4 or 5 of these cups. Yeah. So, you know,
they're laced with
They're
so
laced
much.
with caffeine and they're laced with sugar and they may be laced with cream, of course.
Well,
so you've got a problem with calorie and caffeine.
I want to get on to the energy drinks because and I'm actually going to read these few questions out to you that there are people have got in touch about this. Quite shocking, I think, myself. I'm 57 years old. I drink 4 tins of a popular energy drink every morning as it revives me. What harm am I doing to my body? That's from Claire in Galway. On a similar vein here, there's another one. I drink at least 4 cans of energy drinks a day. I tried to come off it, but I got migraines. Am I doing any harm to my health? I'm a female aged 49. Tell us about energy drinks first and answer those if you wouldn't mind.
Caffeine is a weird drug, medically speaking, because there are those who have suggested that it doesn't do anything to make you more alert or to stimulate you. Now, that is counterintuitive. That seems to fly in the face of what we believe in caffeine.
I don't agree with that, but anyway.
What the medicine seems to suggest that caffeine treats our addiction. So what happens is that over years, in our early adulthood, we become addicted. A lot of us have been quietly addicted. And what the 3 or 4 cups of coffee doing are actually calming down our addiction, the features of withdrawal. So the 2 issues are withdrawal. Withdrawal causes insomnia, the jitters, more of the same, in fact. And the coffee is stopping all of that. Sorry, you were going to say about migraine.
Just the female who was 49 here, she said she gets migraines when she gave up the drinks.
Yeah, so this is the sort of you're caught between to a rock and a hard place, basically. You may be in danger of both overdoing it or underdoing it. And if you're going to give it up, you need to be with dropping your intake by about 10%
but Chris,
every week or so.
that couldn't be right. I mean, surely, is it dangerous to drink 4?
It is potentially very, very dangerous. And energy drinks are killing about 3 people a year in the States, they reckon. Of course, the numbers are probably much greater than that because in the last 5 years, the numbers of people going to the emergency departments in the States have rocketed. They say something like 14,000 people went with just energy drink poisoning to the emergency departments last year in the States alone. There was an infamous death in Birmingham a few months ago from a chap who was apparently guzzling these sort of caffeine-containing mints. There have been reports in the medical literature from young people or young women drinking energy drinks who have developed acute liver failure. So to that lady, I would say, to be scientific, the energy drinks vary hugely. So well-known drinks, the most famous of them all, has actually only 1/3 of the amount of caffeine of a strong cup, but other energy drinks have 10 times as much. So you've got to look basically at the side of the tin. The bottom line is energy drinks can be incredibly dangerous and very, very addictive.
And they contain other stimulants as well, we should say.
Yeah.
They contain more than just the
caffeine. The other weird, unpronounceable ingredients can be quite toxic themselves. So the taurine, the guarana, the niacin and so on and so forth. And of course, I suppose the final point with energy drinks is the alert drunk syndrome. You get a lot of people who mix their vodka with their energy drink and they can be very, very drunk, but at the same time alert. And instead of, God created alcohol in a way that made us fall asleep after too much.
Not to keep you awake.
But he didn't put caffeine into our normal alcohol, as we have. And that's part of what I mean about the kind of industrialization of our pleasures.
Answer for both the questions there, the 57-year-old lady and the 49-year-old, yes, it is damaging you. Be very careful and try and come off it.
Yeah.
Earlier on, we were chatting about energy drinks and caffeine and so on and how much we drink. It's not all bad. Some caffeine is good for us as well, Doc.
Absolutely, in moderation.
In moderation.
3 or 4 cups a day is probably the message.
Somebody got in contact here. Is it true caffeine makes hot flushes and sweats worse?
On balance, it certainly would seem to be the case. I mean, if you look at patient accounts and these, chat lines, flushing and hot sweats would seem to be a very common symptom of overdoing it or withdrawal.
Okay. Yeah,
again, this balance between the two. People are overdoing it or underdoing it. So it's a question of finding your limit and really trying to keep it to about 3 cups a day, which is 300 milligrams. And you may have to look at the side of the tin or the bottle when you're taking energy drinks.
But I suppose if this caffeine drink is something like coffee now, the coffee is going to be hot as well. Yeah. So that's going to add to hot flushes and to sweats as well.
Absolutely.
Along with the caffeine.
Especially if there's other weird things in it, the guarine, the taurine, all this other sort of stuff.
They could be causing the problem. Exactly. Yeah. We've got a number of other questions in as well for Dr. Chris. A lot of people have had an awful lot of colds, and I'm sure you've seen a lot of this yourself. This person got in touch. I developed a cold just before Christmas. It's still not cleared up. I know it shouldn't normally bother a doctor, she said, with a cold, but I just can't shake it off. Are there a lot of people that just can't seem to get over colds?
I mean, you know, upper respiratory tract infections,
Yes.
they're very debilitating, they're very disabling, and they probably last an average of 7 to 10 days. And you can be absolutely miserable and, you know, full of snuffles and just laid low with aches and pains and so forth. Now, the difference in that and flu, of course, is said to be a matter of degree. Flu is said to be you're really aching and you just can barely get yourself out of the bed. But colds, we tend to be dismissive, but they do impair people's performance, and they do typically last 7 to 10 days. The difficulty with flus and colds and so forth is that they're all caused by a different virus. So no sooner have you become immune to or accommodate to or fought off, you know, virus, Mr. Virus O'Shea, you know, than, you know, virus Corona or Duran arrives, you know, and you're not allergic. It's way
worse.
Absolutely.
You'll never get rid of it.
You said it, Dahi, you know, so that's the difficulty. So immunity to one does not confer immunity to the other.
Because somebody was saying as well about a flu, if you're suffering from a flu, if there was €50 on the ground, you wouldn't be able to pick it up.
Yeah, it's true.
Exactly.
No, that's right. I have to have a serious
You'd
flu
have to be in a bad way.
You'd pick it up
You'd be in a bad way.
But if you got the Duran flu, that's strainable.
Oh, good Lord. If I start doing the dishes, all across the top of my back hurts. If I do anything that's repetitive, it aches. It's better if I lean over the sink, resting my elbows on the sink to wash the dishes. Could you give me some advice? Is that repetitive strain injury?
Well, I think the immediate cure to that is to delegate the dishwashing to the husband, you know. Secondly, to think about the actual layout of the kitchen. A lot of it is to do with what's called ergonomics, which, like if you're designing an operating theatre or a resuscitation room, the ergonomics is where you're able to reach everything in a logical and handy. In other words, you're not straining or looking or wasting energy. The ergonomics of a kitchen is much the same. You know, the ideal kitchen is where the oven and the dishwasher and the sink are all reasonably handy rather than going around the island. There's also the issue of the height. You know, my wife's always saying that the oven that she bought, which is a nice oven, but it's too low down for her. So she says she wished she'd have a slightly up. And it may be something like that the sink is too low down. So the ergonomics, the design, the layout of the sink may be the problem. It's possible that it's an inflammatory rheumatic problem. You know, there are inflammatory conditions of the spine that can be, you know, that can be symptomatic like this.
But if you're in the same position the whole time and if it's straining you, can you actually get, can you get repetitive strain injury in your neck?
And the chances are that it is just the layout of the thing. I would probably start the ball rolling with a visit to a physiotherapist, a local chartered physiotherapist.
There's one in here, Doc. My 6-month-old grandson has dancing eyes.
Yeah. Dancing eyes, I presume that person means that the eyes are rolling, and that's called nystagmus. And basically the eyes can roll, they can jerk across like so, or they can actually roll around like that, or there can be a little mixture of the two. And that's a tricky thing. I mean, most of the time we don't know what the cause is. It's called idiopathic. We literally don't know what the cause is. It's just something that the baby or infant has, and it just wears off. But, you know, if there were any concerns, I think I'd probably start with the ophthalmology, the eye specialty doctors, because, you know, there might be a vision thing. There might be something as simple as cataracts or droopy eyes, simple things. But I certainly would get it checked out sooner rather than... Now, I'm not talking about tomorrow or the day after, but just, you know, perhaps go via the general practitioner and get an eye consultation.
I suppose anything like this we should actually deal with.
I mean, by and large, the best person to touch base with is the general practitioner, because they will know the person concerned and will know if something's amiss pretty quickly.
That's great. Dr. Chris,
Thanks,
thank you very much.